Welcome everyone to another YouTube miHygge Shorts. And I'm your host, Dr. Purnima, and here's the topic for today. What are the boundaries and red flags, boundaries or red flags I must be aware of in caregiving? You know, boundaries and red flags are there in everything in the world. If you do gardening, yes. If you do painting, yes. If you're a skier, yes. If you're in a marriage, yes. If you're in a friendship, yes. If you're in a doctor-patient relationship, yes. Boundaries are everywhere. But what about boundaries in caregiving, right? Sometimes what happens is that people do take advantage of caregivers, or vice versa can happen where caregivers are taking advantage of the elderly. So the boundaries and red flags, I'm just going to mention one or two. And I hope you will read our blogs and come to our podcast where I have described more of these things in detail. Um, one simple point for caregiver, right? Boundaries is that what where you trained for, what is your knowledge level, and what were you meant to do with the elderly, and how are you accomplishing that. So if you don't have these straightened out, then it is a red flag for the consumer or the elderly or their family. The other part is for the caregiver about red flags of their customer or consumer or elderly or their family. How are they treating you? No matter what, you have to treat people correctly. So if you're going to treat them wrongly, just because they're a caregiver, that means that is a red flag. If you don't treat them as a part of your human family, that is a red flag. If you do not care for their well-being as much as you care for your own elderly, that is a red flag. And so I hope this resonates with all of you, and with you all, and don't think too deeply, but do take time to understand this, red flags in both scenarios, and then proceed appropriately. So hope this resonates. Please like, share, and subscribe, and hit the bell icon. We love to listen. I'm sorry, read your comments. And I look forward to connecting with you in a more deeper level in the future YouTube shorts. And signing off from California, this is Dr. Purnima for you. And good morning, good afternoon, good evening, and good night, everyone. Take care. Bye-bye.